Breast reduction surgery is an operation that can be considered by ladies who are struggling with the size, weight, and position of their breasts. There are both medical, physical, and psychological benefits to the operation that need to be considered in conjunction with your clinician to work out whether this is the correct operation for you to undergo. All operations have risks and benefits that must be weighed up, of course, but a breast reduction has many benefits for ladies with a bust size that they're struggling with. Yes, if a patient, a lady, is worried about the size of their breasts and has breasts that are perhaps out of proportion with their frame, then a breast reduction is an option for them. No one should ever dictate or tell somebody to have a breast reduction, but equally we can advise that there may be benefits in their particular case. A lot of ladies with a large breast size may be struggling with underwear, maybe struggling with clothing, and in particular, a lot of my ladies will complain of issues with bra strap indentation on their shoulders or neck or back pain, that in some cases, this can be improved by undergoing a breast reduction. So the advantages of a breast reduction are that at the end of the process, of the surgical process, you have a breast size that is reduced. Your breasts have been reshaped and also lifted. So therefore the advantages of that are that you have less of a load around the front of your chest. There are physical benefits often for neck and back and shoulder discomfort that can be improved. It depends a little bit what the pathology is or what the causes of the neck and shoulder pain are as to whether it'll be completely resolved or whether there'll just be some improvements. And there are also psychological benefits, of course, of feeling that you are no longer burdened by such a large bust size. So all surgery needs to be approached understanding the considerations, risks, and side effects, as well as the benefits. All surgery has risks. In particular, there are a few side effects or considerations for breast reduction surgery that need to be considered. You can't do a breast reduction, a surgical breast reduction, without leaving scars on the breasts. Often these scars will involve a scar going around the nipple. Sometimes there's also a scar going down from the nipple to the fold underneath, and then sometimes transversely or horizontally in the fold underneath. Those scars will fade as the months and years pass, and hopefully eventually will just be very thin, pale lines, but they are permanent scars. The other things that could be or should be considered are operating on the breast, especially in a larger breast reduction, may result in some loss of sensation, particularly to the nipple. About 20%, 1 in 5 ladies going through a breast reduction, particularly with the larger breast reductions, will find that they have reduced sensation to the nipples, and therefore it is very important that the surgeon discusses this with you, because you shouldn't go through a breast reduction unless you are aware of the changes in sensation that may come about. The last consideration that's important is to realize that if you're undergoing a breast reduction and therefore having your breast operated on and sections removed to reduce it in size, it may affect your ability to breastfeed. And this is by no means the case for everybody, but it's something you need to discuss with your surgeon. We always take great care to make sure that our patients are not in pain. So when you wake up from your breast reduction, you will not be in pain, because I, as the surgeon, will have put in a lot of local anaesthetic to ensure that your wounds are numb, your breasts are numb at the end of the procedure. And then as that local anaesthetic wears off, the anaesthetist, who will be working closely with me and you as a patient, will be making sure that you're taking appropriate pain relief to make sure that you're not in pain. You will need to, the vast majority of ladies need to take some pain medication for the first week, definitely, and sometimes up to a couple of weeks after that. But it is not a particularly painful operation, and certainly the discomfort can be managed easily with pain tablets. So the operation itself, it usually takes 2 to 3 hours, and in my hands, you're in hospital just overnight for the first night. For the first week afterwards, you're taking it quite gently, walking around, going out for lunch, going out for walks, but you don't want to be doing any strenuous exercise or heavy lifting, and certainly not getting back to sport or other activities like that. After the first week, you come back and see my nursing team, and they will take off the dressings and make sure everything's healing okay. But I generally advise ladies not to get back to their full level of sport and activity and gym work for about 6 weeks. With respect to driving, there needs to be considerations there. We can't tell you what to do on driving, but we can certainly advise you that you shouldn't be driving probably for the first couple of weeks afterwards until you feel fully comfortable behind the wheel. But certainly after 6 weeks, you're in the vast majority of cases, you're fully